Entitlement and urgency in their minds, like not really.
Don't you understand my problem?
All right. Tonight we have Rachel Flossie, who is our Child and Family Health Manager, to talk about fetal infant mortality and child fatality review board. Welcome.
Good afternoon, everybody. So like she mentioned, my name is Rachel Flossie. I am the Child and Family Health Manager here at Summit County Public Health, and we'll share with you about Child Fatality Review Board and our fetal infant mortality review board. So Child Fatality Review Board first, it is mandated by the Ohio Administrative Code. Its purpose is to review the deaths of children under the age of 18 residing in Summit County for the purpose of decreasing the incidence of preventable child death. So really what we're looking at here is from a system standpoint, could the death have been prevented? The functions of the Child Fatality Review Board are to promote cooperation, collaboration, and communication between the groups of individuals and agencies who serve families and children, to maintain a database of all child deaths, to develop an understanding of the causes and incidents of those deaths, and then to recommend and develop plans for implementing local service and program changes, and advise the Ohio Department of Health on the aggregate data, trends, and patterns found from those deaths. Child Fatality Review Board is appointed by County Council. Its membership currently consists of 26 board members, 7 of which are required: the Health Commissioner, the County Coroner, the Chief of Police or Sheriff, Executive Director of Children's Services, public health officials, the Executive Director of the ADM Board, and a physician. We do have 2 committees within the Child Fatality Review Board. The first is the subcommittee, and this is the committee that meets to review the individual cases, and we meet 5 times per year. Then the full committee reviews the patterns and trends and meets 3 times per year. Additionally, we do have ad hoc committees that meet on an as-needed basis to do deeper dives into some of the cases as recommended by the board. There is an annual report that is submitted to the Ohio Department of Health, and additionally one that goes to the community. This is the information that we submit when we review the child deaths in subcommittee. Any agency that has had a touch point to the family or the child that is pertinent to the investigation or the case review is asked to share at that time. And then a determination as to whether or not that death is preventable or non-preventable is made with consensus from the board. When we look at the data from 2021 to 2025, we did review the deaths of 298 children. Of those causes, 60% of them were natural causes, 23% were accidental, 7% were from homicide, 4% from suicide, and 3% were undetermined. And then in that same time period, when we look at the infant deaths, we reviewed 176 of those infant deaths. Of those, 40.1% were due to prematurity, and 20 to 25% were sleep-related. So just by way of definition, infant mortality is defined as a child not making it to its first birthday. When we're looking at that within Summit County and the state of Ohio as a whole, we do know that our Black infants are disproportionately affected compared to their white counterparts, and that ratio currently is about a 3-to-1 ratio. For 2025, our preliminary infant mortality rate is 5.6 per 1,000, with our Black infant mortality rate at 9.1. 5 years ago, in 2021, the Black infant mortality rate was 10.4. So we are trending in the positive direction with that. Compared to the state's infant mortality rate currently is 6.6, with the state Black infant mortality rate at 12.6. Overall, these are the lowest rates we've had in the past 10 years, both at the county and at the state. If you'd like more information regarding our infant mortality rate, along with the patterns and trends, our data dashboard on the Summit County Public Health website is the best resource to go to for that. Additionally, the Ohio Department of Health and the Ohio Department of Children and Youth both just released their annual report on infant mortality, and those are additionally great resources. So it's one thing to review the cases and to recognize the trends, but of course, we need to look at what are we doing as a community to move the needle and work to fill any gaps that we see. One of the focuses that Child Fatality Review Board has taken in the last 2 years is to ensure that we are educating the CFRB board members about the resources and programs available within our community that are working to combat these issues on a daily basis. With infant mortality making up more than 50% of our cases annually, there's a strong focus on our infant vitality programming. With that, we do have a very robust infant vitality program here in Summit County underneath the partnership of Full Term First Birthday with the City of Akron and the United Way. This represents a vast network of community partners whose sole goal is to decrease Black infant mortality to 6.0 per 1,000 births. And we do this by ensuring that the community can find the quality resources and services needed within the network in our community. Our Safe Sleep initiatives are spearheaded out of Akron Children's Hospital with common messaging across our infant vitality network. And of course, we also want to focus on the other end of the spectrum, representing the child deaths and teen deaths. And with that, we highlight the mental health and youth behavior programming coming out of the ADM board, the City of Akron, and agencies like Greenleaf. There's some significant work being done in this space with the Youth Risk Behavior Survey and the programming that stems from that to address the needs of our school age and teen population. I invite you to take a look at their report on their website if you would also like a deeper dive. Shifting gears a little bit to the Fetal Infant Mortality Review Board, this is allowed and governed also by the Ohio Administrative Code and operates underneath a mini grant with the Ohio Department of Health. This is a multidisciplinary, multi-agency, community-based program that identifies local infant mortality issues through the review of fetal and infant deaths and develops recommendations and initiatives to reduce those deaths. Membership for FEMR is not mandated, but closely mirrors the same membership for the CFRB board. Meetings are held quarterly for both case and maternal interview review. And the cases are reported in the National Center for Fatality Review and Prevention database, which is also where we report our CFRB cases. We do have a community action team that is a subcommittee of the CFRB board, and they annually review the trends to make recommendations. And a new initiative coming back to the local health department is the Sudden Unexplained Infant Death Program, and this is a program with which we reach out individually to the families who have lost a child due to a suicide death and offer them bereavement support and resources. When we do the case review, these cases are de-identified in the FEMR board. We look at both the preconception, pregnancy, and postpartum health of the birthing person. The depth of our case review is dictated by the records that we receive, and often the records that we are receiving are only labor and delivery records. We don't often get the prepartum and postpartum care. Interviews are offered to every single family with which the FEMR board reviews cases to provide them, of course, the opportunity for bereavement support resources, but we also want to sit and hear their story, honor their infants, and identify if there's something from a systems standpoint that could have been done differently. And then any feedback from those is shared with the board as the next review. So with that, I will attempt to take any questions you might have, but my contact information is also there, and I'm sure that can also be done out. Sure.
Around 7, 8 years or more ago, we were dead last or next to last of the states in the U.S. It's very encouraging to hear that we've done better compared to the rest of the state. How are we compared with other states? I'm assuming they also have improved because it was a terrible black eye we all had. How does Ohio compare now?
Yeah, so as far as on a national level, we are still unfortunately at the bottom of that. We're within the last 10. So when I first started here 10 years ago, we were at about 48. We're closer to 44, which is reflective of some of that positive change. Also, as a state, we are in still the top 10 counties that have poor infant mortality rates. Within that, when we look at it from a Summit County standpoint, a lot of our infant vitality programming is focused around those areas with high infant mortality rates within our county.
I assume that some of the most difficult counties are the ones that are most populous. Thank you.
Any other questions, I think? Tasha's great.
Thank you.
Thank you.
All right. We will call the meeting to order at 5:09. Can I have a board member roll call, please?
Chief Chafin?
Here.
Dr. Cook? Here. Dr. DePompe?
Here.
Mr. Gano?
Here.
Ms. Jindal?
Here.
Franz?
Here.
Colner? Here. Mr. Lowry?
Remote.
Mr. McGuire?
Here.
Dr. Mamonis? Here. Mr. Snell?
Here.
Mr. Somerville? Ms. Williams? Here. Thank you.
Thank you. All right, I need a motion to conduct business by voice vote unless a roll call vote is specifically required by our bylaws, state law, or is requested by a member of the board. Any discussion? All right, can I have a roll call vote?
Chief Chafin?
Yes.
Dr. Cook?
Yes.
Dr. DePompe?
Yes.
Mr. Gano?
Yes.
Ms. Jindal?
Yes.
Mr. Karan?
Yes.
Ms. Colner? Yes. Mr. Lowry?
Yes.
McGuire?
Yes.
Dr. Mamonis?
Yes.
Mr. Snell?
Yes.
And Ms. Williams?
Yes.
Thank you.
Okay, thank you. All right, can I have a motion to approve the Board of Health meeting minutes from May 14th, 2026? Any discussion? All those in favor?
Aye.
Any opposed? Any abstentions? Okay. Motion passes. I don't believe, any public and/or staff comments? Okay. There are no Schedule E late filings today. Can I have a motion to adopt resolution number 018-26 entitled Approval of the Consent Agenda, Schedules, and All Matters on the Consent Agenda? Any discussion? All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? Okay. So moved. Moving to committee reports. I don't believe there's any community health and wellness, governance, human resources, or strategic planning committee reports. Financial operations.
There was a finance report, yes. Finance Committee met on May 14th at 5:52 p.m. Items discussed during this meeting was, number one, there was a election of a committee vice chairman. That is why I'm reading this tonight. Thank you so very much. I appreciate that. All approved.
All right. Thank you.
I got more.
Oh, you have more. Okay. All right.
We had a couple of discussions during this meeting. One was on capital updates. Commissioner Barker gave us an update on suggested capital improvements projects for this year, for next year, and answer questions. There was no decisions from the committee. We also had a discussion on competitive bidding. Recent updates to Ohio Revised Code Section 917 surrounding competitive bidding thresholds established by the Ohio Department of Commerce. There was a suggestion that was made to update Summit County Public Health purchasing policy to reflect recent ORC changes, allowing for an annual 3% increase as published by the Director of Commerce. And there was a vote on that, and the vote was unanimous by the committee that we recommend changes to Summit County Public Health at this month's board meeting. And there was no miscellaneous business, and we were adjourned at 6:17. That's it.
All right. Thank you, Chief Chafin. All commissioners report.
Yes, on June 4th, the Labor, Health, and Human Service Appropriations Subcommittee approved the advancement of the fiscal year 27 Labor and Health and Human Service Bill. Within that bill, Health and Human Services is funded. A total of $110 billion in discretional spending is allocated, representing about a $4 billion cut for Health and Human Services compared to the FY26 levels. Breaking down the appropriations, it's a little early still with the interpretation, but we were able to capture some of this in dialogue and the language that was in the appropriations. Project BioShield will be fully funded. This funding goes to BARDA, which is really for medical countermeasures advancement. This is very similar to what President Bush did after 9/11. Multiple programs also will be consolidated. This includes hepatitis funding, STD funding, and TB prevention funding into a block grant. This was mentioned in a previous Health Commissioner's report that this likely will occur. Funding for Title X family planning will be eliminated in this proposal. SAMHSA funding will be decreased slightly. However, they will still be targeting funding towards substance use treatment and substance use prevention services. That's where harm reduction potentially is funded from, unless changes occur. And also maternal and child health programs, they're funded $1.1 billion, and it looks like they will receive a $121 million cut to their total allocation. Also, the bill does not propose funding for the creation of the Administration for a Healthy America. That was one of the biggest proposals in the president's. It is still unclear at present regarding HIV funding specifically and also PhET funding specifically. As this moves to the full appropriations committee, more detailed information will be released, and NACHO will be conducting a full analysis of that. That's usually where I get most of my summary assessments from the bill, but also the additional documentation will also be published that I can dive a little bit deeper, hopefully for our next board report. Also, for Ebola, the first reported case occurred in the Democratic Republic of the Congo on April 4th, but it's likely that it occurred earlier, potentially up to the time of January. That's just some of the estimates that CDC indicated on one of our calls. The official declaration of an outbreak occurred on May 15th. The strain which is occurring is the Bundibugyo strain. This strain was first discovered in 2007 and has a fatality rate of 30%. The U.S. has implemented travel screenings for individuals returning to the U.S. from affected countries, and that is occurring not only in the country where the departures are occurring if they are known to be traveling back to the U.S., but also through 4 points of entry at designated airports. Within the DRC, the current reported case count is 635 with 127 deaths, and in Uganda, the current case count is 119 with 2 confirmed deaths. That is updated daily, and I believe those numbers were from yesterday. Also, on June 3rd, the first U.S. case of the New World screwworm was identified in Texas. This is the first U.S. case in over 60 years. As of now, several cases have impacted livestock in Texas, and a new case was also reported in New Mexico with an infested dog. USDA has implemented a 20-kilometer infestation zone with quarantine movement controls and has heightened surveillance efforts around those locations. USDA is increasing trapping along the border and implementing education and outreach initiatives to local producers, veterinarians, and the community, and has also released sterile flies within the infested area to mitigate spread. According to USDA, the U.S. food supply remains safe. New World screwworm does not infest meat, fruits, vegetables, or other food products, and they do not believe it will have any impact on commerce. I just wanted to make that statement. It doesn't directly affect us here in Ohio, but that has major implications nationally. We also have a new employee here. Edith Dillard is our new fiscal officer. She's against Belinda, so thank you, Edith. And we have an old face here, Ryan Pruitt, who is our food supervisor. He's here as Tanya Burford's on vacation. So thanks, Ryan, for coming. The Governance Committee is scheduled to meet immediately following this meeting here in the boardroom. The Community Health and Wellness and Strategic Planning Committee is scheduled to meet next month following a regular stated board meeting. We also have a motion pertaining to our cybersecurity program. This is a requirement with House Bill 96. And not only does it meet the requirements for House Bill 96, this is also a disaster recovery and business continuity concept that we fully endorse. So may I request a motion to approve resolution number 019-26 entitled "A Resolution Adopting a Cybersecurity Program for Summit County Public Health to ensure the security of information technology resources in accordance with Ohio Revised Code Section 9.64. Second. Any discussion?
I got a question.
Sir.
Kind of a general question. I know that for businesses, we were told that one file being exposed was a $40 fine. And so when you have thousands of people under your care, there's a tremendous liability. How does that apply to government agencies like us? Does that, you have the same sort of issues, or are you protected from that?
Same concern. I believe it's per document, correct? I'm going to defer to Eddie Mink, our IT supervisor.
There's a cap with those once you reach certain levels of records. There's also a law that they're passing, the safe harbor law, in the state of Ohio, that as long as you follow a set guideline, like a industry standard, that there are some limitations they're going to put on liability because it is so hard technology now to help with all the. There are some individual fines, but there are caps.
Eddie spearheaded the development of this policy and worked on its implementation. So, thank you, Eddie. Okay. I have to make a.
Do you want me to read this again?
Please, I think we just need to make a
Okay.
motion.
I think Roberta did
Roberta,
make a motion
Dan.
and Dan seconded. So all those in favor?
Aye.
Any opposed? Any opposed? Any abstentions?
Thank you.
Mm-hmm. The floor report.
So as Chief Chafin, alluded to, we did discuss, updating the purchasing policy for the health district, to better align with the, Director of Commerce's update annually to the, competitive bidding threshold. So, I did put a write-up of the edits to the policy in your packets. So I would just need a motion, and a second adoption. SCPH Policy Manual, Policy Number 1103, purchasing effective June 12th, 2026.
Over.
I can answer any questions if there are any on that.
Any other discussion? All right, all those in favor?
Thank you.
Any opposed? Any abstentions? All right, motion passed.
Thank you.
Thank you.
You also have our monthly reports as well, and I can. Thank you, that's been the report.
All right, clinical health medical director's report. Joanne is here.
Good evening. The communicable disease report is attached, as well as a final influenza surveillance report. So that will be the last report for this season. Any questions? Answer them.
Okay. Thank you. It was the quickest meeting. All right. We will adjourn the meeting and move into our governance committee. We'll adjourn the meeting at 5:23.
Be a record.
I think that's correct.
I know.
Very short.